Welcome to Sage Integrative Wellness and our Sage Chronicles Integrative Practitioner Spotlight audio series. My name is Dominique Fontaine, the founder of Sage Integrative Wellness. The Sage Chronicles Integrative Practitioner audio series is a sacred space where our readers, clients, and listeners can tune in and receive their dose of rich and valuable life-changing information from various holistic health practitioners and holistic entrepreneurs all around the world to continually support you on your health and wellness journey. Since it's National Nurses Week, really the month, and also the year in 2020, today I have the pleasure of sharing with you all April Hatch.
Hello, thank you for having me.
Thank you, April, for being here. I'm super excited.
So am I.
I'm going to share with our readers about you because you have so much of a unique story, and I think it's so awesome to be able to be honored to share your bio and your information and let our readers know all about you.
Perfect.
April is the founder of Cannabis Care Team and Respite Nurse. She has worked in acute care before obtaining her master's in public health nursing. She knew the best way for patients to get well was to provide the education they needed to make their own informed health care decisions. She has always focused on the whole person and holistic nursing, but it wasn't until her son suffered a traumatic brain injury that she discovered how miraculous cannabis could be. Now she strives to educate patients, their loved ones, and the community on how to effectively and safely consume cannabis. April is healer certified, a member of the American Cannabis Nurses Association, the Society of Cannabis Clinicians, the American Holistic Nurses Association, and the Hospice and Palliative Nurses Association. Oh my gosh, April, welcome. You have so much exciting, juicy stuff going on in your life.
Yes, thank you. And that does sound like a lot, all of those organizations, but really it's just such a wonderful opportunity to be a part of those. I learned so much from them, but thank you for the intro.
Yes, you're a rock star, girl. Oh my God. So I want to know, and our readers want to know, let's start from the beginning. And I know we're from two different states here. You're in Kansas City, Missouri, and I'm in Scottsdale, Arizona. But I want you to just share with everyone how you and I originally connected before we dive into all the amazing things that you offer individuals. So I'm going to let that space be open to you and just share
Okay.
how we got connected originally.
Absolutely. So, Dominique, you're a member of the American Cannabis Nurses Association as well, and that's how we connected. Over the last year, we've been working on putting Cannabis Care Team together, which is an organization that focuses on, as you said, providing education to patients on consuming cannabis safely. And, that's how we got connected. You are doing similar work, and we both really strive to do the same things. And, I can say that for the first time in 15 years of nursing, over the last year, really working with cannabis patients, finally feel like I'm truly helping people. So it's been very beneficial, and it's just so great to be a part of the organization, ACNA, that you're a part of. And there's just so many mentors and supportive nurses out there, and it's been wonderful to meet you and talk to you and so many other nurses as well.
Yes, I love that we have our unique tribe there. Like,
Hmm.
I found my people. Like,
I know.
so excited. Like, just another olive branch of holistic nursing and like super niche. But I think it's really cool to be able to help individuals and learn about safe cannabis medicine. It's really cool. I mean, What about you? Did you ever think in a million years you'd be sitting here like having an open conversation or even practicing with cannabis? Like, I surely didn't.
No, absolutely, I did not. Although when I was in high school, I was on the debate team, and the topic was legalizing cannabis. And I always was an advocate for legalizing cannabis, but I honestly thought it would never happen. And so many people told me it would never happen. So it's very exciting. It's taken Missouri a little bit longer than most states, but it's finally here, and patients are really starting to see the benefits. I talk to patients every day, and everyone is just telling me how much it's changed their lives, and it's wonderful. So, absolutely did not ever plan on this, but it's just, it's a wonderful opportunity to allow patients to heal with other things besides pharmaceuticals in your traditional medical model.
Definitely, for sure. I think it's so important to have an open lens of endless possibilities to explore for optimal health and also improving people's quality of life because, um, that's so important on the whole of everything else. Like, that is what we want to focus on is really improving and advocating. So I love that we can definitely
Yes.
explore into other ways of healing.
Absolutely. I completely agree. It's the quality of life that, really is what made me bring up cannabis with so many patients. Of course, with my son, that was a different story. But when I started to see that so many of my other patients could really benefit, um, they do have a better quality of life. I mean, just by the fact that THC can reduce pain so effectively, I mean, they're able to function, they're able to complete those activities of daily living, they're able to spend time with their family without being in pain. And, as we know, pain leads to immune system dysfunction and depression, anxiety. So, yeah, cannabis can really help with so many things.
Absolutely. Well, tell us a little bit because I was reading and I want to make sure that our readers and everyone that's here today listening really understands about some of these organizations now. We've talked about Holistic Nursing Association before. Can you elaborate to some of the individuals that may not be familiar with public health, for one, cannabis nursing? We elaborate on that a lot here, but just from a different perspective from where you're seeing that view from your state, and also about healer certified.
Yeah, absolutely. So when I went to school to get my master's degree in public health nursing, it was because I really wanted to promote health and prevent disease, and that is ultimately the goal of public health. Is to not focus on the diseases that patients already have, but really to prevent those diseases from happening in the first place. And typically, you get that by providing education and interventions prior to being diagnosed with a disease. So, public health, disease prevention, health promotion, that's that right there. With cannabis nursing, I find that patients are really looking for a healthcare professional who is knowledgeable with cannabis. So many of the physicians that are writing certification for cannabis currently, they know the basics, but they really can't go into detail with patients on picking out a treatment plan, or maybe they don't know about all of the dosing methods. So patients are really looking for someone that they can talk to, that they can trust. Of course, you know, all all people love nurses, right? And so I just have been able to develop a connection with so many people and been able to provide that education, and that's really what I do. So cannabis nursing right now for me in Missouri is really about education and then also advocacy and teaching patients to advocate for themselves, how to have that conversation with their primary care doctor or their pain doctor who may want to stop prescribing opiates because they're consuming cannabis. And then just provide a lot of support for patients because there is that stigma out there with cannabis. And, patients like to know that there are healthcare professionals out there who support them and what they're doing. And also, I can share the research with them to show them, that cannabis does really work. And with healer certification, Dr. Dustin Sulak is a physician who practices in Maine, and he has treated thousands of patients with cannabis and often is sent the most difficult patients throughout Maine. Other physicians have tried to help them with cannabis. They're unable to, so they go see Dr. Sulak, and he has created a program, and not only for nurses, but for anyone who wants to become healer certified. They would take a series of 3 online courses where you go over the benefits of cannabis and really everything you need to know about getting started or helping someone with cannabis. It's a really great program, and it's a certification I even encourage patients to complete as well.
Absolutely. I think that that's so important. And Dustin Sulak, he's an amazing physician. I love his background. I love all the support that he gives on a whole person spectrum. I think that's
Yes.
great. I think totally for patient side and also the healthcare worker that's interested in learning and educating themselves more about cannabis.
Yes, and he has a wonderful program that is available to nurses and physicians, that you would go to Maine and spend time seeing patients with him. And I did that as well. And it really was eye-opening to see him interact with so many of his patients he was treating with cannabis, and just a wonderful opportunity for any nurse or physician.
It's amazing.
Yes.
So tell us more about like how you really stay so humbled and grounded between work and like your personal life. What's going on that keeps you really, really steady and whole?
Well, I would have to say it's because I love what I do. So I spent years working in acute care, and I definitely would say I wasn't in the same state of mind I am now. Very stressed and overwhelmed, and constantly bringing my work home. Even in public health, I would do, visits, home visits with community members, and I couldn't let it go in the evenings, and it was really overwhelming, and I just wasn't able to separate, my work and family. And now that I find, I love what I do and I'm able to feel really good about helping people, I'm not worried about it and I'm not consumed with it all evening when I'm trying to focus on my family or
Mhm.
when I'm trying to focus on myself. So, I would definitely say that there are some people who just make really good nurses, and I don't want to brag, but I think I make a really good nurse because I care so much about helping people. But that can also, um, you know, unfortunately for some people, when you're caring for others all the time, you have a tendency to not care for yourself. So I do always have to watch that, and I have to make sure that I'm eating right, I'm sleeping, I'm exercising, I have time for myself. I do those things to care for me.
Yeah. And you talked about some like eating, exercising, anything other like self-care strategies that you enjoy doing to just keep yourself grounded?
Well, I love gardening and it's springtime, so I haven't put my vegetables in the garden yet, but I've been working on a lot of gardening projects, and I've got several flower beds outside that I've been working on. So just getting my hands in the dirt and being in the sun, honestly, is probably the most therapeutic thing I can do for myself. I love it.
That connection with nature. I love
Oh,
it.
yes, yes.
Nurse herbalist as well. I hear you. Well, one of the things that I think we have in common a lot, we have a few things in common. But one of the things I want to say in honor of mental health awareness for the month of May, I
Mhm.
usually share a lot about trauma for like anyone that has really gotten to know me or like work with me directly, and how to reduce suffering in various different health and personal experiences. Can you talk about like what your career philosophy is and like how you've been unable to bounce back and manage and become resilient in the midst of like dealing with traumatic things? Right now we're experiencing a global crisis.
Yes.
So, what do you think has been really helpful for yourself and also supporting your clients in dealing with traumatic experiences or any challenges they face?
Well, I think what's been helpful for me is, like I mentioned, a few of the things: exercise, diet, just a healthy lifestyle overall. And that is, it's really important to support those things among my patients as well. So in a time like this, and I have seen more and more patients suffering from anxiety and depression since COVID and since all this physical isolation, really helping patients nail down those activities that are going to, you know, reduce stress, reduce anxiety, and, you know, if that's finding an activity that gets their heart pumping, that they enjoy doing, that's not considered exercise, or if that's making a list of 5 things they can do if they start to feel overwhelmed or stressed. Um, just listening to people and really helping them work that out themselves, I think has been really important. And I think that that's a big part of my career philosophy overall is, you really need to listen to patients to be able to provide the best interventions. Patients can honestly come to those conclusions themselves, but just to have someone to talk it through,
Mhm.
um, it's, makes a huge difference. And, to advocate for them and their desires and what they want, and just, be a supportive person is critical, I think, for patients, especially during this time.
Yes, it's so neat. And I think that co-creation of their plan of care and having them involved is so empowering for them to have like that self-efficacy piece, and really inspire themselves to continue to press on.
Absolutely. I think nurses and doctors make the worst patients because we we don't, we think we know a lot and we don't want people to tell us what to do. So, it's when I've been to the doctor, I've been told, you need to do this or that. And we just don't do the things that we are told to do. We need to come to those conclusions ourselves. And, really that's when it is the most effective. And that's when we find those activities or those lifestyle changes that we're more likely to stick with.
Yes. And speaking of cannabis, science and all that, those enjoyable activities definitely benefit us when we do not have our cannabis. And
Yeah.
works amazing. So I think that self care piece is huge in both not only our patients, but also our lives as well, too.
Oh, yes, it is. It's huge. Yeah, I think we're so lucky to have the research we do on cannabis and the different cannabinoids and terpenes and how those benefit us. And, it's like a new world for me and caring for myself. And, you
Yeah.
know, it's been wonderful.
Yes, I must say I have truly geeked out in the world of cannabis for
Yes,
myself, and I have never looked back. So,
same
as,
here. Yeah.
as a cannabis patient myself, I think that's another thing that we talked about before, and having that similarity, and how cannabis has supported you on your journey. Talk to us about that and how you really have come to, a new experience with cannabis.
Well, to discuss that, I probably have to go back to the injury my son suffered. And so that was about 5 years ago. And my son was playing football. Although I never wanted him to play football in middle school, he said, I'm going to do it. And I was just happy he was playing sports. So by the time he was a freshman, he was playing and he was a good player. But after one game, I picked him up and he said, Mom, I felt really dizzy. I had a headache. And, honestly, me at the time, being a typical nurse mom, ibuprofen and Tylenol and some ice, like let's go home.
Yes.
And it wasn't until about 3 o'clock in the morning he came in my room and he was literally screaming and crying. His head hurt so bad. And
Mhm.
that's really when it all started. So probably for the next 2 years of our lives, we struggled with post-concussion syndrome. We had seen a physician early that morning and was told, okay, go home, put him in a dark room, take away his phone. Nobody ever told me about the chronic migraines, the episodes of syncope. I mean, I would find him laying passed out on the ground in random places, and no one talked about the depression, the anger, the suicidal ideation. So, I was really at a point where I thought I was going to lose my son to suicide. And it was a psychologist and a neurology nurse practitioner and my son, of course, who said, you've tried everything over the last 2 years. Have you ever thought about cannabis? And I knew cannabis was beneficial for so many other patients, regarding pain, nausea, vomiting, cancer, all of those things, but I really didn't know how it could affect him. And so that's when I really started to do all my research, was really trying to figure out the best treatment plan for him, because a physician was not going to be able to tell me he needs to take this, he needs to do it this often. And he was 15 at the time, so I was a little worried about that. But so that was about 5 years ago. And I can say that now, 2 years, in the last 2 years, I have not gotten a phone call at 2 o'clock in the morning from my son telling me he wanted to die. I, it's, I can sleep at night. I'm not worried about that phone call. And that was my constant fear for 3 years. And um, he's just doing so much better. And that was really when I saw, hey, wow, the cannabis can do this for him. And, as a practicing nurse, up to the time he got his injury, I was working for a big corporation where I would have been drug tested, and it was prior 2018, so it wasn't legal in Missouri yet. But, um, you know, now that I'm working for myself, I've been able to do a lot of experimenting and find, what works for me, not only to help me sleep at night, but also to just promote health and wellness overall. And it's, not necessarily just about the cannabis, it's really about promoting the health of my endocannabinoid system.
Mhm.
How can I feed that throughout the day?
Yeah.
Um, so it's been an amazing experience, and I'm so thankful that I've been able to find cannabis and that my son was able to find cannabis, of course. And I just want to share it with as many people, or share the knowledge I have with as many people as I can, because, after so many years of there being such a big stigma, you know, we have to get out there and tell people that it's really been shown to be effective for, I mean, honestly, over 200 conditions. So
Mhm.
I I currently prefer to microdose THC, if your listeners are familiar with that term, but I do prefer to take small amounts. I feel um, like with my type of personality, I like to stay busy. I don't like to sit down. I like to go, 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 go. I do need something to just kind of help me relax throughout the day and, take the edge off a little bit. And
Mhm.
then, of course, at night, I just want to keep going and going. And I want to do all these things. And I really have to make sure I get enough sleep. So sometimes I have to force myself to take a little bit of a higher dose, but just, so I can get sleep.
Yes. No, totally get it. I totally understand. I can relate to a few of these
Yeah.
random, different reasons why I use it, why I'm a patient, and why it's been very effective for me, my lifestyle. So I'm super excited how open and honest you are in helping us all destigmatize, cannabis, and also share about how it's important to feed our endocannabinoid system. all
Yes.
throughout the day because of that importance of the fact that we could potentially sit in a state of deficiency if we do not actually feed our endocannabinoid system. So I'm really glad that you actually brought that up.
Yeah, and there was a period of my life, maybe 7 years ago, when I was really suffering from migraines. And I had been through nursing school, and I had been a nurse for almost 10 years at that point, and I had not once heard of the endocannabinoid system. And now to hear that, something like migraines could, and the
Yeah.
endocannabinoid deficiency syndrome, I mean, those two could have very well been connected. And now I can look back, oh, my was not getting enough omega-3 fatty acids. I was not getting the appropriate exercise, and I was not able to reduce stress like I am today. So, things could have been a lot different for me, and then things could have been a lot different for so many other patients. I work with a lot of patients who have Parkinson's, and at this point they're really just trying to control their tremors or the anxiety and depression they feel from having Parkinson's. And now we know that cannabis and a healthy endocannabinoid system can, I mean, really, we're hoping can prevent conditions like Parkinson's in the future.
Yes, it's truly amazing and innovative science and research that is still growing over the years, and even clinical trials that are being done to continue to help others. So I think it's a fascinating time that we're in, and I love that we have this tribe as healthcare professionals that can actually truly get educated in this realm, because like you said, like it was not in our nursing school books, it was
Yeah.
not in our medical books. I personally feel like, oh, I got gypped for my own knowledge. Like, how did I not know about this? But now that
I
I
know.
do, I'm so geeked out, and I love it because it's the missing piece of the puzzle for a lot of things that we just did not realize. It's truly
Absolutely. I know. I'm so happy to be a part of it now, and just to see where it goes over the next 50 years.
yes,
It's amazing.
truly. Well, share with us about what it is that you really teach about with others in cannabis care team and respite nurse.
Okay, all right. So respite nurse is really something I started after my son experienced that traumatic brain injury, and I had to leave my full-time job. I wasn't able to take FMLA because it was a salaried position, and I would still be working that many hours. I would just, probably be doing it at 2 o'clock in the morning because I was spending most of my day caring for him or either carting him around to physical therapy or speech therapy. So I loved what I did before, but I really needed to stay home and take care of my son. So after about 6 months, when he was doing a little better, I heard about a couple patients who needed some respite. So what that means is, or their family members needed some respite. So these are patients who were living in a home with a family member, and the family member was their primary caregiver. I really missed that patient interaction, and I felt like, you know, this could be a service for these patients. They're looking for someone to come care for their disabled or family member who's on hospice, just so they can go to the grocery store, just so they can go to church. And I have the absolute ability to go there and take care of them. I have the skills, I have the knowledge, and I'm a licensed professional, so I care very much about my license. And it was really an opportunity to do something on a part-time basis that I needed, because I needed patient interaction, and the family member really needed some respite. They needed a break.
Mm-hmm.
So that's what I started doing, and that's why I really came in contact with so many hospice patients who I found could benefit from the use of cannabis. Anytime I would visit these patients, and usually it was about 4 hours at a time. May have been once or twice a week, but they had 3 new meds that they didn't have the week before, or they had upped their morphine and upped this or that. But they were still really suffering. And, I just felt like, why aren't these hospice physicians talking to these patients about cannabis? And at that point, it still wasn't legal yet. Um, so I completely understand them. But, I just really saw an opportunity to educate patients about the benefits of it, not only for hospice patients or the disabled, but so many other patients, patients who are experiencing cancer, patients who were just wanting to promote wellness, stress reduction. So I really did start to talk to several people about the benefits of cannabis and the different studies that had come out. And I had people calling me, people sending me messages on Facebook, like, I hear you're a nurse and you know about cannabis, and they have questions, it be dosing, it might be, what strain would benefit me, is it safe to smoke, is it safe to use a vape pen? I found myself doing a lot of that and answering a lot of those questions in my off time. And I thought, there really is value in this, and I could really provide this as a service to patients. And so that's when we really started to develop Cannabis Care Team, and my mom has been really the business marketing person with that. She's great. It's wonderful to have a company with your mother as well. It's been such a great experience. But really with patients, and just, I want to understand why I'm doing something. I want to understand how it's going to benefit me. So patients want to know about the endocannabinoid system. I mean, they're fascinated by it, really. So, really giving them a review of that and talking about, I mean, there's so many different things that patients are concerned about when it comes to cannabis. Patients are concerned that it's going to cause brain damage, that it's going to cause lung cancer, that they're going to overdose. So really just sharing the research with them and where some of these myths have come from has been helpful for patients. And, dosing is huge, and delivery methods are huge. As you know, there are how many ways that you can consume cannabis, and they all start to work in different periods of time. They all last a different, different length of time. And
Yes.
it just can be really overwhelming for someone who is really new to cannabis.
Oh, yeah.
So we try to just really meet the patients where they are, and help them based on what they need as individuals. So maybe they just want to talk about the potential benefits of cannabis. Maybe they're not ready to get certified and go out there and start consuming. Maybe they've been consuming for 20 years as a recreational user, and they want to learn how they can do it more for health benefits. So really, it's individualized based on what the patient needs.
I love that. And keeping them at the center, again, I think that's
Yes.
super important, because that's a different perspective when they actually get to be involved with their care.
Mm-hmm.
It's more, the results are more positive because it's something that they really want to do, and it's enjoyable and they understand. And it becomes a natural part of their lifestyle when they can include their core beliefs or what they need. So I love that that's patient center is really where it is, and where that's the foundation of how your practice is. I love it.
Yes, thank you. I love it too.
So as the humble, genuine, kind nurse that you are, I want to know, like, if a kid were to walk up to you asking you for some sage tips, what would you share with them?
All right, some sage tips. So let's see, if someone were to walk up to me, I think that so many people ask the questions that they already know the answers to.
Mhm.
So just kind of really um, helping them focus on what they already know, and those tips that they're already thinking about. So just, listening a little bit more to their question, and usually there's a couple that they just want to hear your opinion on, but I would say that sage tips for cannabis patients specifically, because most of the people I interact with currently and speak with on the phone are cannabis patients. So tips would definitely be number one, to start low and go slow. That's a very common saying among cannabis professionals. I just hear about some bad experiences patients have when they go to the dispensary and they end up consuming too high of a dose. So, even starting at half a dose or half the recommended amount is, where new patients really need to start. So that would be my number one tip: start low and go slow. And then number two, honestly, is I really want patients to understand how important their sleep is. When we're sleeping, that's when our bodies heal. And if we don't get a good night's rest, the whole day can be just ruined for us. Our anxiety is going to be high, our pain level is going to be high. So when starting with cannabis, the most important time to consume is in the evening before bed to ensure you get a good night's sleep. So you may have some anxiety during the day that you really want to treat, but go back to the night before. Make sure that you're getting that sleep so you can have a successful day the next day. So I would say those are two very important tips that I would share.
I love that. Our sleep is so important. And when we don't get enough, our body's going to let us know some way or another.
Yes, it does.
It has a funny way of letting us know one way or another. Are there any sage tips that you would like to share with our other integrative practitioners or holistic healers or holistic entrepreneurs out there starting their journeys?
Yeah, absolutely. So I would say if you're doing something that you love and you're passionate about, it never feels like work.
Amen.
Um, really, and like I said, I mean, I love what I'm doing right now. I am so excited to get up and start working on it right away in the morning. So yeah, find something you love to do and do it. And then the other thing is make sure you take care of yourself and you engage with your family members and those who love you, because that connection we have with ourselves, that connection we have with other people is, provides so much, really honestly, for our endocannabinoid system. Just there's so many health benefits, for any health system when you're really focusing on caring for yourself and having just loving, joyful, fun relationships with others. So take care of yourselves, spend time with family and friends.
Love it. I love it. So, April, where's the best place our readers, listeners, and clients can reach out to you for continuing a meaningful connection?
Absolutely. So, April at cannabiscareteam.com is my email. So, if anyone ever has any questions or needs any support, they can reach me there. Cannabiscareteam.com. You can also contact us through our website, and we do schedule consultations through our website as well. But I'm here to help people, and I want to help as many people as I can. So reach out by email. Our telephone number is on the website. Contact us by phone. I'm here to help. So absolutely contact me. Whatever is easier for your listeners.
Wonderful. Well, April, I'm so grateful to have you a part of our Integrative Practitioner Spotlight series. Thank you so much.
Dominique, it's really been a wonderful experience. Thank you for having me, and thank you for putting this spotlight on so many of the healthcare practitioners that occasionally don't quite get the spotlight, because what we do in our holistic practices, we really are changing lives. And it's amazing to hear so many stories from the different nurses and doctors I speak with who are doing it, just going about it a little differently. So thank you for sharing
Yeah,
this.
absolutely. Is there anything else you feel like you want to share before we wrap up?
I can't think of anything. I mean, check us out on Facebook as well, Cannabis Care Team. And I think, yeah, it's been wonderful. Thank you so much.
You're welcome. We'll definitely have all of this information on our newsletter and our website so that you guys can follow up with April's information. Definitely reach out to her. Wonderful, wonderful colleague. Super excited to have interviewed April. So I don't know about you, but this was definitely nourishing and filled my cup up. So I want to say to all of our listeners, readers, and clients, thank you, thank you, thank you for joining Sage Integrative Wellness and tuning into our Sage Chronicles Integrative Practitioner Spotlight audio series. This is the place where you can receive your dose of rich, valuable, life changing information from a variety of holistic health practitioners and holistic entrepreneurs all over the world so that we can help co-create and support you on your health and wellness journey. Until next time, stay nourished and empowered, and remember to make this day the best day that you've ever had.